Hello everyone, my today's lesson is about measles. Measles is a most common childhood problem which is a vaccine preventable disease. Measles is a highly contagious viral disease with a serious complication such as a blindness in a children with pre-existing vitamin A deficiency, and it can cause high mortality in children and also in malnourished and immunocompromised children. And the measles virus is a single-stranded lipid enveloped RNA virus in the family Paramyxovidae and the genus Morbillivirus. The two most important in terms of induction of immunity are the hemagglutinin H protein and the fusion F protein. The neutralizing antibodies are directed against the H protein, and the antibodies to the F protein limit proliferation of the virus during infection. When we see the pathogenesis of measles virus, viral entry via respiratory mucosa or conjunctiva, and the measles virus replicates locally, and this spreads to the regional lymphatic tissue, and then it disseminates to the other reticuloendothelial sites via the bloodstream. And during secondary viremia, measles virus invades the body organs. Incubation period of measles virus is from 10 to 14 days. When we see the clinical manifestation, there are different clinical manifestations of measles virus. We can classify them as a classic measles, modified measles, atypical measles, and a severe measles. Classic measles is when there is infection in immunocompetent patient, whereas modified measles is in a patient with a pre-existing but incomplete protective and anti-measles antibody, whereas atypical measles is in a patient immunized with a killed virus vaccine, and the severe measles is when it causes giant cell pneumonia, when measles causes inclusion body encephalitis in immunocompromised patient, and also measles at the extremes of age, and also measles with a vitamin A deficient patient, and also measles during pregnancy can be classified as severe measles. Measles consists of 4 phases: incubation period, prodromal illness, exanthematous phase, and recovery phase. During incubation period, measles virus migrates to the regional lymph nodes, and the primary viremia disseminates the virus to the reticuloendothelial system, and the secondary viremia spreads the virus to the surface. The prodromal illness begins following the secondary viremia, and it is associated with epithelial necrosis and the giant cell formation in body tissue. Virus shedding begins during the prodromal phase. With onset of the rash, antibody production begins and the viral replication and the symptoms begin to subside. Measles infects CD4 T cells like HIV, and it resulting in immunosuppression of the Th1 immune responses and a multitude of other immunosuppressive effects. When we see the mode of transmission, the portal of entry of measles virus is through the respiratory tract or the conjunctiva. The patients are infectious from 3 days before the rash up to 4 to 6 days after the onset of the rash, and approximately 90% of exposed susceptible individuals develop measles. And face-to-face contact is not necessary because viable virus might be suspended in air up to an hour after the case leaves a room. Measles is a serious infection characterized by a high fever, aninanthem, cough, coryza, conjunctivitis, and prominent exanthem. And coplic spot is reported to be present in 50 to 70% of measles cases, and it's a pathognomic sign of measles. And this coplic spot appears 1 to 4 days prior to the onset of the rash, and it first appears as a discrete red lesion with bluish white spot in the center on the inner aspect of the cheeks at the level of the premolars. And it also involves the lips, hard palate, and the gingiva. And it may occur in conjunctival folds and also in the this is an image of coplic spots on the buccal mucosa during the 3rd day of rash on a 3-year-old child. Rash begins around the forehead, around the hairline, and also it begins behind the ears and on the upper neck as a red maculopapular eruption. It then spreads downward to the torso and extremities, reaching the palms and the soles in up to 50% of cases. With the onset of the rash, symptoms begins to subside and the rash fades over about 7 days in the same progression as it evolved, often leaving a fine discoloration of skin in its wake. Of the major symptoms of measles, the cough lasts the longest. It lasts for up to 10 days. This is a child with measles displaying the characteristic red blotchy pattern on his face and also on his body up to the level of lower extremities. This is a classic rash of measles. Infants or recipients of breed products develop a subclinical form of measles as we described above, and then the rash might be indistinct, brief, or it might be rarely or entirely absent. Persons with inapparent or subclinical measles do not shed measles virus and do not transmit infection to household contacts. This is a case definition of a measles. The standard case definition of measles is we say a suspected measles if any child suffering from the following symptoms: fever greater than 38.5 degrees Celsius and lasting for greater than or equal to 3 days, typical maculopapular rash, and presence of cough, coryza, or conjunctivitis. And we say it's a confirmed case. A confirmed case is one in which suspected case is confirmed by laboratory, either as a viral isolation or antibody elevation. Measles in the latter stage or in apparent or subclinical cases might be confused with a number of other exanthematous immune-mediated illness and infections such as rubella, adenovirus, enterovirus, Epstein-Barr virus, exanthema subitum, retema infecciosa, mycoplasma pneumonia, group A streptococcus, Kawasaki syndrome. Just to mention some differential diagnosis. For example, in rubella, to differentiate rubella from measles, the rash and the fever occur simultaneously. So the rash of rubella occurs at the same time with fever, and the rash classically begins on the face and spreads downward. And on erythema infectiosum, the rash is prominent on the cheeks. And also on scarlet fever, the rash is confluent and it is preceded by pharyngitis. And on roseola infantum, 3 to 5 days of fever that resolves abruptly and is followed by development of rash. So this one has 3 to 5 days of rash. Then when the fever disappears, the rash starts. Atypical measles is called when there is high fever and headache followed by maculopapular rash on the extremities that become petechial and purpuric and also progressed in a centripetal direction. This is complicated by pneumonia and pleural effusion. It is caused by development of circulating immune complexes that formed due to abnormal immune response. When we see the diagnosis of the measles, we can diagnose measles if the mother clearly reports that the child has had a typical measles rash, or if the child has fever and generalized maculopapular rash and one of the following: cough, runny nose, and eyes. And severe complicated measles is defined as in a child with evidence of measles, any one of the following symptoms and the signs indicate the presence of severe complicated measles: inability to drink or breastfeed, vomit, severity, convulsion, also the presence of loss of consciousness. And on examination, look for signs of late complication after the rash has disappeared, such as lethargy or unconsciousness, corneal clouding, deep or extensive mouth ulcer, pneumonia, dehydration from diarrhea, stridor due to measles group, and malnutrition. They are all signs of severe complicated measles. When we see lab findings and the lab diagnosis in measles, total white blood cell count decreases with more lymphocyte decrease than neutrophils. And the confirmatory diagnosis is IgM antibody in a serum is 100% positive when it is taken between 4 to 11 days after the onset of rash. So IgM antibody detection in a serum of a suspected patient is a confirmatory diagnosis. And also fold rise in IgG antibodies in acute and convalescent specimen taken 2 to 4 weeks later shows recent measles infection. As a complication, the most common complications are infectious complications. From the infectious complications, the most common ones are otitis media, bronchopneumonia, laryngotracheal bronchitis or croup, diarrhea, and tuberculosis. This pneumonia can be due to the measles itself, or it can be secondary infection by bacteria such as strep pneumonia, Haemophilus influenza, and Staph aureus. The other complication of measles is severe malnutrition, and the other is blindness. And rare complications include hepatitis, encephalitis, and subacute sclerosing panencephalitis. This subacute sclerosing panencephalitis is a degenerative CNS disease that can result from persistent measles infection. When we see the treatment or medical care of a child who is affected by measles disease, antiviral therapy is not effective in the treatment of measles in otherwise normal patient. And the most important things are maintenance of hydration, oxygenation, and the comfort are the goals of therapy. Antipyretics for comfort and fever control are useful, and case fatality rates are higher among children younger than 5 years of age. And highest fatality rates are among infants aged 4 to 12 months and in children who are immunocompromised because of HIV infection or malnutrition or regarding antibiotic administration, antibiotics are needed for otitis media or bacterial pneumonia, and for all measles infected child, vitamin A supplementation is needed, particularly for children aged 6 to 24 months. For less than 6 months, 50,000. For 6 months to 1 year, 100,000. And for greater than 1 year, 200,000 international units. PO as a single dose and a repeat dose the next day and at 4 weeks. Measles vaccine or human immunoglobulin to prevent or modify measles in exposed susceptible individuals can be given. This is all about measles in a child, and thank you for your attention, and also don't forget to subscribe this channel.